My name is Dr. James Jenison. I specialize in both internal medicine and pediatrics in Evansville, Indiana. I also have a practice that involves age management medicine, where we actually look to try and prevent disease from occurring rather than with the more traditional medical treatment of just treating disease as it occurs. The advantages or difference from coming to me versus going to the MEC center or urgent care center, they're focused on one small problem at that specific time. There's a lot of impetus for them to just give a medicine and get you out and get the next person in the door. I tell people that oftentimes they may have to wait to see me a little bit, but it's because everybody, when they come in, gets their full turn. And we don't just address one thing, we try to look at their whole body. And I have two jobs. I have a job to make people better when they're sick, and sometimes that's not as hard as maybe the second job, which is trying to prevent them from getting sick in the first place, which is really the whole emphasis on that. We even start that with my pediatric training in the children to try and get them off to a healthy start, and then actually take that all the way through into the adults to not only now keep them healthy, but to prevent them from having some of these devastating illnesses going forward. We found a new way to treat diabetic peripheral neuropathy, and we've really just had such success with that. People have burning in their feet, they hurt, they can't feel their toes, and we're using a technique that stimulates the nerves in the leg. We've been able to actually not just cover up the pain, but actually make the pain go away. It is a big deal to people to not have that problem any longer. And it's if I have someone with high blood pressure and I make them better, it's good, they're healthier, that's fine. But when I make someone's neuropathy go away, it changes their life. And that's really been an exciting part of what we do. The whole innovation into hormone replacement and normalizing hormones. A lot of the fear there in the past was whether these hormones were going to cause problems, going to cause cancer, going to cause problems with the medication, heart problems, and now we're finding it's just actually the opposite. These hormones are preventing cancer, they're preventing cardiac dysfunction, heart dysfunction, lung dysfunction, and the quality of life for these people is just rapidly accelerating. It's really giving people some opportunity to really live a long quality life and be more functional. Don't have to quit work, don't have to stop doing what they want to do, don't have to stop traveling. They can continue doing all these things. They don't have to live in a nursing home. It's an amazing area of medical science that's really gaining a lot of momentum. One of the things I really have a passion for is 90+ children that I get to help take care of in Honduras. There's a place there called Faith Home outside of San Pedro Sula, and I got to go there probably 7 or 8 years ago for the first time. And the first time I went there, I kept trying to figure out ways to get out of it. I was a little bit nervous traveling to that part of the country. It's not always the most safe place in the world. And then I found that after I've been there, I spent a lot of time trying to figure out how I can get back. I'll see the children at the orphanage and do the best I can do to help them. And then I get to go up into the mountains in the surrounding area. Oftentimes we'll see 1,200 or 1,300 people in 4 days. Could be over 100 degrees. It's in the jungle, and it's really been a big blessing to me. It's an opportunity to kind of share some of the blessings that God has given me, and I can share that with them. It's really been one of the big joys of my life. We are accepting new patients, and if you're interested in some of these treatments, contact me, and we look forward to being a part of your healthcare team.